This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about a common running injury, which includes hip abductor and flexor tendon strains. If you like this video, we put out new content weekly, so please like and subscribe. So there's a whole host of different injuries you can get by running, mostly all involving the lower body, and basically any part of the lower body can get injured when you run. So sometimes people will have hip pain, and it hurts them kind of on the front of their hip or on the outside of their hip. So two reasons that can happen are hip flexor strains and hip abductor strains. So flexor, your iliopsoas muscle, is the muscle that helps you move your hip upwards. And that'll be pain kind of right in the front of your hip. If I were to stand up, it's kind of like pain like right here, while abductor strains are kind of like towards the side of your hip. The main reason you would get these injuries is, one is overtraining, but also overtraining, lack of strength, and not being flexible. So if you're not flexible when you're running, then you might be moving it in abnormal ranges of motion, and you're more likely to strain it. If you lack strength, what will happen is as you run and you get tired, your form will start falling apart, and then that's when things start moving funny, and that'll cause a strain as well. And then overtraining, simply, if you run too many miles, you're going to get hurt. They recommend increasing mileage at about 10% a week. Obviously, there's a lot of nuances to running and not getting injured while running, but the more you train, the higher likelihood you are of having an injury. Most of the time, thankfully, hip flexor strains and hip abductor strains will go away on their own. There's the standard ice and anti-inflammatories. It's sort of hard to elevate that area. You can, though. That might help a little bit. Honestly, one of the ways to get rid of it, the easiest, and which most people don't want to hear, is taking time off of running, which I know can be very difficult, and taking the time to stretch and strengthen those areas so that it doesn't come back. That being said, I do get people with some hip abductor strains and hip flexor strains, and I will do some corticosteroid injections before they have a race or something, just to calm the inflammation down. That usually gets them, sometimes we can get rid of it, and sometimes it will help them calm down. If those areas are bothering you and they're not getting better, then sometimes it's more than a muscle strain, so you have to look a little bit deeper. Sometimes the iliopsoas will strain because someone has something going on inside the hip joint and is trying to protect that. So you could have hip arthritis or a hip labral tear, which you can tell on x-ray and MR arthrogram, respectively. On the abductors, rarely I've seen it where someone will actually tear those abductors off or really injure them. That's a surgical solution as well. Usually the way to tell with that is an MRI. But again, most commonly, they're just strained. They'll go away. If you have pain on the front of your hip or the side of your hip, stretch it, strengthen it, you should be fine. If not, then there's more that you need to do. So I hope I was able to answer your questions about common running injuries, which include iliopsoas and hip abductor strains. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any medical advice because this video and all my videos are for educational purposes only. Thanks for watching.